100 people in Wayne County are considered a rural area, that to me seems like that definition's not very appropriate.
At a House Appropriations Committee meeting in Lansing, the topic was healthcare, but a lot of the questions raised had to do with geography.
I'm looking at your map and I see that Wayne County is the same as Lapeer County. They're not. But I also see that St. Clair County is not rural, but Oakland County is.
A comparison of counties because of this map from MDHHS.
The question that I get asked the most, the number one question is, what is rural in Michigan?
It matters because the green rural counties and the light green ones, partially rural, according to MDHHS, are eligible to apply for $173 million in rural healthcare grant funding through President Trump's so-called One Big Beautiful Bill.
The state of Michigan applied for this money. I don't think we did a great job of stating our case. Just giving an example, Ohio got $209 million. South Carolina got $200 million, and they have 5.4 million people. Michigan got $173 million, and that was only about $30 million more than the lowest state out there.
But not all that $173 million will go towards actual patient care.
One of the main concerns we kind of had when we got through the list was $18.8 million of this money is going to administrative cost in developing these programs, sending out the money. The state of Michigan will get about $18.8 million in the DHHS system that won't be going out in rural health care.
But for a collection of Northern Michigan lawmakers, another perhaps more pressing concern goes back to that geography question and how rural is being defined.
The problem is when you look at the map, how DHHS classifies rural, partially rural, or urban, Grand Traverse and Leland are in the same area as Wayne and Oakland counties. They're considered partial rural districts.
Which means they will go toe-to-toe for the funding.
It's going to be, in my eyes, a little difficult.
The Center for Medicare and Medicaid Services left it up to states to define rural. MDHHS chose to use the Federal Office of Rural Health Policy Standards.
CMS did not provide necessarily a definition for what would be rural for all states to abide by. Instead, they said, you know your state best, you tell us.
This one raising concerns. In hearings, MDHHS admits concerns will be listened to and taken into consideration when grants are awarded. But many Northern Michigan lawmakers say they aren't comfortable with the definition, the map, or what seems to be a reoccurring trend.
It seems like every issue that comes up, even if it says rural in the name, we still have to fight for that money to come north.